Okay, it's time to start, even though some people are still joining us a little bit later. Welcome to this session. My name is Lucas Goossens. I'm the Program Director of the Health Economics Policy and Law Master Program, including the specialization Health Economics. In this session, we also have Maureen van Duin, who is a HEPL student at this moment. She will be able to answer your questions, especially later on about what it is like to be a HEPL student. We have Susanne Verheul, who is a student marketeer in the Erasmus School of Health Policy and Management. And later we will be joined by Isabella Fabricotti, who will moderate the chat. She is the program director of the Healthcare Management Program. If you have any questions, please ask them in chat. There will be many questions that you ask and that will be answered later in my presentation anyway. Isabella will keep track of it and lead your programs, lead your questions on to me. I said it was Maureen van Duin, who is a HEPL student. We also have Maurice Katz, who does the Health Economics specialization, which is also part of HEPL, with a very different focus. And I will get into the differences between HEPL and Health Economics in my presentation. Okay, let's start. I am going to share my screen so you can see the presentation. There we go. I hope you can all see it. So I am going to tell you in the next 35 minutes about HEPL and Health Economics, what they are about. I'm going to zoom into two courses that these programs share, and then some practical stuff like how is the program organized, how can you be admitted, what can you do afterwards. And we will have a lot of time to answer your questions, probably at the end session, but maybe if necessary in the meantime. Okay, in general, we are talking about two programs here. The multidisciplinary HEPL program, about economics, policy and law, and the health economics program, the monodisciplinary version. They have a lot in common, but there are also major differences. First, the things that they have in common, they are both about improving healthcare, health systems, and health policy. Formally, we say that the programs are designed to provide students with conceptual knowledge, analytical skills to understand and explain the complexities of healthcare systems and health policy issues. So they are not about managing hospitals, they are about managing systems at a higher level, at a national or an international level. It's not about the organization of institutions in healthcare directly. It's important to explain what I mean by health system. It's not a combination of hospitals. By health systems, we mean how healthcare is provided and paid for in the country and how decisions are made. And these healthcare systems, the health systems, are different across countries. The Netherlands have a very different system than the UK, than the US, than France. All countries make different choices. For instance, do you have a market-oriented system where insurers or hospitals are in it for profit? Or is the total healthcare business in the hands of government, or a mixture of both? Who owns these institutions? Are there health insurances, and what is covered by this health insurance? Who decides that? Doctors, are they entrepreneurs who are paid per service, or do they get a salary from the hospital? When you use healthcare, do you have to pay something, or is it free at the point of use? And you can also study whether everybody has equal access to healthcare, or that some people find it easier to get treated in the hospital, for instance, because they have more money or for another reason. So that is what health systems is about. This graph, we use a lot of graphs in health economics, and this graph shows you how much money a lot of countries spend on healthcare, and all countries spend a large proportion of their GDP, of their national income, on healthcare year after year. In the OECD, that's more or less a club of developed or rich countries, it's about 10% of what they earn every year is spent on healthcare. And there's one outlier, the USA. They spend much more on healthcare than all the other countries. But as you see in this graph, the second country on the left, the Netherlands, is also very high expenditure, although there's still a large gap with the USA. So healthcare costs a lot of money, but we do get a lot back, and that is health. We are buying health. This graph shows declining mortality rates over the past 25 years. So in all these countries, fewer people die as a proportion of the population. And even Corona doesn't change that very much. And this decline in mortality rates is for a large part due to better healthcare. So we are paying more and more, but we are also getting more and more. But still, you can ask, are we getting value for money? Are we really willing to spend this much money for this amount of healthcare? Could we do it with a smaller investment, or could we get even more health for the same amount of money? That's an important issue in these programs. This is a slide that you will see for every course that you follow. These are the more specific questions that we answer in HEPL and also in health economics to a lesser extent. But all courses focus on different questions. What challenges do health policy makers face, and what options do they have? How can economic thinking help understand the behavior of patients, providers, payers, and policymakers? What is the performance of different healthcare systems in terms of the health that they produce, the equity of access, the equity of payment? How is policy shaped? Who is involved in that? What are the legal conditions for health policy? An economist can think of a policy that is really good from a certain perspective, but are we allowed to do this if we have to take into account human rights, for instance? And finally, how should empirical research in healthcare be conducted and interpreted? So it's about theory, it's about practice, and it's about research. This is the curriculum for HEPL and health economics. You see that they have a lot in common. Everything in green and orange or red is what they have in common, but the parts in purple and yellow are different. I'm going to talk about two of the courses in this presentation, the courses in block 1 in bold, presented here, Economics and Financing of Healthcare Systems and Economics of Health and Healthcare. It's important to note that we have 2 semesters. The first semester consists of obligatory courses. Everybody has to do them, depending on the program that you choose, HEPL or Health Economics. And then we have a second semester, which is dominated by your thesis and the elective courses. So the structure is the same for HEPL and Health Economics. Many courses are the same, but not all. And Health Economics, I have to say, is provided by the Erasmus School of Health Policy and Management, that's where I work, and the Erasmus School of Economics. It's a joint venture. So this is the structure of the year. And now I'm going to zoom into 2 programs, or 2 courses, 2 core courses. The first one, Economics of Financing of Healthcare Systems. It's an obligatory course for everybody in block 1, 6 to 7 weeks, starting in September. And it describes the type of healthcare systems, market-based, government-based, and their characteristics and the consequences of choosing a certain type of system. And they are analyzed mainly from an economic perspective. This is really an economics course. Maybe we should have practiced this, but I think we can try it anyway. It is possible for you to raise your hand if you click on participants you can choose to raise your hand. And I would like you to raise your hand if you agree with this statement. Healthcare expenditure goes up and up every year. That is a problem. It should grow less. If you agree with this statement, please raise your hand. I will not ask you to say something about it, so you can do this risk-free. Should it? See some hands going up. Some people change their minds, pull down their hand again. Okay, so around between 30 and 40 people in the room who agree that they should grow less. Okay, you can take your hands down again. Now I would like to see how many people disagree with this statement, who thinks, no, it's not a problem. We can afford this and it's worth it. So it's fine. It shouldn't grow less, maybe even more or at the same pace. So who does not agree with this statement? It seems to be about the same proportion, a bit less, but apparently the majority here doesn't have an opinion about this yet. Okay, thank you. Thank you. You can get your hands down again, and I will have another statement for you to respond to later on when I talk about the next course. Healthcare expenditure should grow less. If you agree with this statement, it's probably important to know why healthcare expenditure grows so fast. I messed up in my presentation. Why do expenditures grow so fast? There are several reasons for this. One is advancing medical technology and science. More and more is possible, more technology like scanners and stuff like that, which are expensive. More expensive drugs come on the market, and if they are available, people want them, and doctors want to use them to treat their patients. That costs money. As a consequence of that, the population ages. Many people don't die of heart attacks when they're 60, so they get to live longer. They get older, and they are able to get new diseases, some of them chronic, which also means that healthcare is becoming more expensive. So the growth in expenditure is for a large part, can be described to the success of healthcare. Healthcare is so good at giving people longer lives that they also need more healthcare. Another factor is that while we become more and more prosperous, we put more value on healthcare and we are willing to pay more for it. There's an economic concept called Vomal's cost disease, which means that healthcare will become more expensive even if there is not more of it. As people in other sectors of the economy see their salaries go up, people in the healthcare sector will demand the same, or they will leave the sector. So even if they keep providing the same amount of healthcare, they will be paid more for it, making healthcare more expensive. And what also plays a role is different incentives for healthcare providers and patients. If healthcare is free for patients at the point of use, they will use more of it compared to a situation where they would have to pay something. If a healthcare provider gets paid more if they treat more patients, they will treat more patients. So there are some economic incentives for all the players. Issues like that, they are central in the course Economics and Financing of Healthcare Systems. The next course that I would like to discuss is called Economics of Health and Healthcare in Block 2. It's another obligatory course for HEPL and Health Economics, and it's about analyzing the performance of healthcare systems. How well do they do? Are they equitable, meaning that does everybody have the same access, or rich people only? And who pays for it? Does it depend on how healthy you are, or does everybody pay the same? And efficiency is the second topic. Do they provide value for money on the level of the program of the system? I have another statement for you to respond to, and I'll give you the answer afterwards. But first, I'd like to ask you, who thinks that this is true? Rich people benefit more from healthcare than poorer people. This is in general in the in industrialized world. That's what we're talking about. So raise your hand if you agree that rich people benefit more from healthcare than poorer people. And I'll present you with a way of looking at this afterwards, after you've voted. So the count, we were stuck at 33, but it goes up again. Okay, we were again 36, 35. Okay, get your hands down again. And now I would like to ask people who don't agree, who don't think that rich people benefit more from healthcare than poor people. So if you disagree with this statement, raise your hand. If you haven't raised your hand, see, still about a third of people in the room have now raised their hand. And the vote's about 50-50. Okay, so thank you for voting. I'll show you a few graphs that are also used in this course to see which of you were right. This graph shows the relationship between healthcare expenditure per country at a certain moment in time and mortality. So higher mortality means less health. We have 6 curves here, 3 green ones for men, 3 red ones for women, and they are stratified by their education level. There are a few patterns that we see here. For instance, there is more mortality among men than among women. It's not surprising. We know that generally men live shorter lives than women do. And there's also more mortality among people with lower education. We see that among men as well as among women. So that's one pattern. We also see that all groups benefit when healthcare expenditure goes up. And we see that because all the curves are sloping downwards. With higher expenditure, mortality goes down for all these 6 groups. We also see that mortality decreases more for men and people with lower education. If you look on the left of the graph, the curves are very wide, spread out very widely. If you look on the right, they are much closer together. So actually, reading this graph, you see that healthcare increases equity in health outcomes, and people with a worse socioeconomic position tend to benefit more than people with a worse background. Of course, this is not directly about how rich they are, but it does tell you something. In general, in the industrialized world, the people who benefit most are people who have most to benefit, and which are generally people with lower incomes, lower educational backgrounds. This might come as a surprise for some people, but this is what we see in the data. Another graph from the same course, Economics of Health and Healthcare. It's about health spending per capita, again on the x-axis, and a health measure, a different health measure on the left, a life expectancy in years. And in black, there is a curve that seems to show a limit, a frontier. It's very difficult to get more health for, if you are willing to spend 4,000 euros per capita, to get a higher life expectancy than 81, 82. You see a positive relationship, of course. People, countries that spend more tend to have better life expectancies, but there is a limit to it. And there are also a few countries that are really underperforming. If you look at Russia on the left, they are spending about the same amount of money as Poland and Chile and Brazil and Mexico, but their life expectancy is 5 to 10 years lower than those countries. Of course, that's not all due to the health system, but this indicates that Russia should do better for the amount of money that they are spending. And on the right, again, the perpetual outlier, the USA spends much more than the rest of the world, but does it do much better than the rest of the world? No, it doesn't, at least not when we look at life expectancy. It does even slightly worse than most of the countries that spend much less than the US. So this is a way of seeing how well health systems perform. Okay, so I have now discussed a few courses in the first semester of the curriculum. I don't have the time to really go into all the other courses, but I am going to tell you that we have many elective courses to choose from. All of these courses are available to HEPL students, and all the ones in black are available to the health economic students. Some of them have an economic focus, and also policy focus. There's competition policy in healthcare. We have global health economics and health economic development and policy for people interested in health economics and developing countries. We have several very technical methodological courses, advanced health economic modeling, measuring of patient preferences. There's a lot to choose from, and you can find details on these courses all on our website. So that's the contents of the program. Now about the organization. Of course, this year is very different. In Corona times, we have to do everything or almost everything online. We hope to go back to campus next year. I think we will still have some online work. Sometimes that's just better and more convenient than doing it live on campus, but most of it will be moved back to campus if that's possible. If you choose to study HEPL or health economics, you will follow lectures. Some of them will be videos online, some of them will be in lecture halls. There will be work group meetings on campus, PC labs. Sometimes you will just ask to prepare, to have a short preparation online. So that's all consuming education. You'll also be asked to make presentations, read a lot of literature, write essays, do exams, and everybody is also going to write a substantial master's thesis where you do actual empirical research. An important element that we have at Erasmus University, ESHPM and ESE, you will be taught by teachers who are also prominent publishing researchers in their own disciplines, be it health economics or health services research, health law, healthcare governance. They are all prominent in their field. And we also have guest lectures, and we have examples from the real world. It is about theory, it's an academic program, but the theory is about seeing the real world, about analyzing the real world. So you will see a lot of examples. This year we talked a lot about Corona, and I assume that it will also be an important topic next year. But there's also things like how much do people have to pay for their healthcare in certain countries, and how is access provided here and there. The study load, we expect you to be available 40 hours a week, 5 days a week. For most of the year, you get 2 weeks off at Christmas, and there are some weeks for exams in the middle of between the first and the second semester. Depending how well you have done in the first exam, you will have to do more or fewer re-exams. And in the weeks, except for these few re-exam weeks, you will have between 10 or 16 hours of contact with us, which means lectures, work group sessions, meeting your thesis advisor, etc. 10 to 16 hours, that doesn't seem like a lot, but we also expect you to do a lot of work by yourself or in cooperation with other students. So it really is a full-time program. We don't provide a part-time program. Of course, it is possible for you to say, well, I'm not going to do both courses in this block. I'm going to do only one. That is possible. You're allowed to do this, obviously. But we cannot guarantee that this course that you're going to follow will always be on Mondays and Tuesdays, for instance. So we don't facilitate it. We don't encourage you to do it this way. But if you can make it work in combination with a job you have on the side, you are free to do so. This is what our graduation looked like in 2019 in the aula of the Erasmus University. It's a very festive occasion. We hope we couldn't do it this year, but we hope that we will be able to do it again in 2020 or 2021. And if you decide to start studying in September, that you will be on this stage in 2022, throwing your hat into the air. After this, you have a wide range of opportunities. Our students end up very different places, and government departments, international organizations. Many have a research-based occupation, like in universities or in consultancy firms or in the pharmaceutical industry. Many people work in insurance companies or other organizations in the healthcare sector. And we even have one former student who is a member of the European Parliament for Hungary. We often get questions about the difference between HEPL and healthcare management, the other one-year master's program of ESHPM. And the difference is very clear, actually. There's a big difference. If you want to be a hospital manager, healthcare management is your program. And if you want to look at healthcare from a national or an international perspective, then healthcare is there. HEPL is there for you, or health economics. The difference between HEPL and health economics is not about the topics. It's all about health and healthcare. And economics is important in both programs. The main difference is that there are more statistics, econometrics, more analysis in health economics. There is some of this in HEPL as well, but even more in health economics. If you are interested, this is what your background can be if you want to be admitted. If you studied one of these programs in a Dutch university, master's or bachelor's, policy management, public health, economics, policy sciences, law, medicine, or pharmacy, you will be admitted to the program if you have formally done one of these programs. All applications and all other applications are evaluated individually by our admissions committee. And we will also admit you if you have done something different, but you have a sufficient background in economics, policy science, and or in research methods. We will look at everybody individually, and we will try to find ways of admitting you. If you have a degree not from the Netherlands and not from an English-speaking country, you will have to provide proof of your English proficiency, and there are different tests that you can use for this. Some people may have questions probably about their own personal situation. I did this or that. Will I be admitted? I'm not able to answer those questions in this session, but I would advise you just apply. Use StudyLink to apply for this program, and you will get an answer in a few weeks. You will have to provide proof of what you did beforehand, but we will be able to tell you within a few weeks whether you are admitted or not. So, as a conclusion, if you are interested in healthcare, if you like economics, if you like policy, if you like looking at things from different perspectives, then HEPL or health economics may be the right program for you. And if you think you are interested, we would be very happy to welcome you in September of 2021. More detailed information can be found on these websites. The website of Erasmus University for Health Economics Policy and Law, or Health Economics. And you can also find us on Facebook, on Instagram, and we have a feature called Unibody where you can talk directly to our students. We also have some students here in the room. You can ask questions, but if you want to do this later on, we have a uni buddy for that. Okay, that is the end of my presentation. I suppose that you have some questions for me, and I'd be very happy to answer them.
Do you need some help with that, Lucas?
Please, yes. I see that there are some questions in chat, but I haven't read any of them, and I suppose you have, Isabel?
Yeah, I have. So one of the questions is, what is the difference between HEPL and OHEM?
Okay, OHEM is the main difference, at least maybe it's interesting for you to know that there will be a presentation about EOHEM at 1. There are a few differences. One is that EOHEM is a 2-year program. It's also partly about health economics, but also about management. You can choose different tracks there, but it's a 2-year program, and it's also a cooperation of 4 universities, not just Erasmus University Rotterdam, but also Oslo, Bologna, and Innsbruck. So you will travel around somewhat, and you will have to be at least 2 of these places at some time. You will just live in Bologna for half a year or in Oslo. So the scope of EOHEM is a little bit broader, but the international aspect is probably the most important difference with HEPL.
And there are some questions about the difference between HEPL and HA, or the choice between those. So what are reasons for people to choose for HEPL, and what is the difference in this regard to choosing for HA? That's one question about the difference. And the other one is if the assignments and requirements for HEPL and HA are the same or different.
I'll try to put up the curriculum slide again. Meanwhile, I can say that the admission requirements are the same for both programs. So if you are admitted to HEPL, you can also choose health economics. This is the slide for the curricula. You see that there are a lot of courses that are the same, but the different courses in yellow for health economics are all very methodologically focused. They are all about applying statistics, or econometrics as we call it in economics. All these 3 courses. So if you really like to work with statistical software and do your own analysis, if that's what you like most, then health economics is probably the best program for you. And you will also be able to do so in HEPL. You can also choose very economically focused electives, and you can do all these analyses in your thesis as well. So you can bend HEPL, multidisciplinary HEPL, in the direction of health economics. If you choose a multidisciplinary HEPL, you also get the courses International Health Law, which is mostly about the human rights in healthcare, and Comparative Health Policy, which is about how health policy is shaped. So if you want a broader perspective, you choose HEPL, and if you really want to go into hardcore statistics, then you choose health economics.
With regard to comparisons, not only between OHEM, HEPL, or HEPL and HA, there are also many questions what the difference is between HEPL and other masters that resemble HEPL at other universities.
Yeah, I'm not able to go into detail of all the other programs that exist, but something that we have in Rotterdam is that we have a very broad health economics and HEPL program, which looks at health economics from different perspectives, but also deeply. And whereas other universities often combine this with management or public health, we are more focused on economics. But if you really want to have a detailed comparison, I would advise you to look at the other schools' programs. I'm more at home in my own.
Then I have a question. If there are medical students or medical doctors following HEPL, and what could be the added value for them to do a HEPL master?
Actually, we have many medical students, and the reason for is different for everybody. Some of them want to know more about the context, about the world they are living in when they are treating patients. And some of them would really want to participate in shaping that world. An important course that I haven't discussed yet is called Health Technology Assessment in Block 2. That's about choices that are made in healthcare. When a new drug comes on the market, you can assess whether it's worth the money. Doctors would like to use it for their patients because it's available, but society might say, no, it's just too expensive and we would like to spend our money elsewhere instead. These decisions are usually not taken by doctors, not taken in the hospital, they are taken at the government level, but they are very relevant for doctors. Just like they also see the consequences of policy when people have more or less access to the healthcare sector because they have to pay more when they want to be treated. So there are many doctors who find these questions interesting. They are not only interested in treating patients, but also in the wider surroundings, and that may be a reason for them to do this. If you say, I want to be a doctor, I want to be there for my patients, I want to be up to date with the newest developments in medicine, then there is not much added value. But if you want to take part in discussions about guidelines, about shaping policy, then this is a really valuable program.
Then with regard to the content of the program, there are two types of questions. One is it possible to do an exchange, and if so, where? And the other ones are about, can you do an internship?
The exchange, we have a limited possibility for exchanges. We have a cooperation with the University of Oslo where you can do some electives. We have put the program on hold this year due to Corona, but we are we're hoping to open it again next year. And if you find an opportunity to do an exchange with a different university, you are free to do so, but you have to arrange it yourself. Internships. We don't provide internships for students who want to get some working experience, but we do have internships that are combined with the thesis. So you can write your thesis while you are at an insurance company or at a different research organization. Again, the objective then is not to learn to work for the insurance company, but it is to do research in a different environment. And this year, I think about a quarter of students, now a little bit less than a quarter of students writing their thesis is doing this as within the context of an internship.
With regard to the international focus of HEPL, also two types of question. What is the balance between the focus on national and international healthcare as one question, and then the other one is more regarding the student population. What is kind of the percentage of national and international students?
Okay, that's the easiest one. That does change over the year, but in general, I think somewhere between 15 and 20% of students are non-Dutch. And the program is not focused on the Netherlands at all, except for the fact that Dutch health policy is interesting and it serves as an example to some countries in the world. For instance, Obamacare in the US is partly based on the Dutch system. So from that perspective, the Dutch system is very interesting. But we also look at the American system or the British one, the German. Examples come from all over the world, mostly from Europe and North America. But there are also some courses that are about Africa and Asia, South America, developing countries' healthcare systems. Well, the economic theory is international, and so are the examples, and some of them are Dutch. But if you are not from the Netherlands, don't worry that we'll only talk about the Dutch healthcare system. We won't.
A very easy question. How many students start each year?
Well, we grow a little bit each year. Actually, this year we grew a lot. And this year, about 200 students started HEPL or health economics. 200.
there are a lot of very specific questions about people describing what their prior degree is and if they are admissible for HEPL. So perhaps you can tell what they can do to get an answer to this question.
If you want an answer, please apply, and you will get your answer, especially if you apply now. We don't have as many applications yet this early in the year. We will be able to answer you within a few weeks if you give us all the information, but you have to apply formally, and we will look at your application. In general, what we look for is a background in healthcare and economics. Policy as science is also possible. And if you have one of those, the extent of the background may be different for everybody, but if you studied, if you have a bachelor in economics, you will be admitted. If you did a bachelor of a very different program, but also had a lot of elective courses in economics, you may also be admitted. So it really, it's an individual decision. And we try to make it possible to study HEPL or health economics for as many people as possible, but it's not for everyone. So if you want to know, please just apply.
Okay. Then we have a question for Maurice Katz, who is here and is a student of HEPL. The question is, Maurice, why did you choose this program, and what did you like most and least
so far?
Last year I finished my bachelor health policy and management, and then I had to choose a master. And I found economics really interesting. So first I applied for the health economics specialization, but after I think 2-3 weeks I switched from the specialization of health economics to HEPL. I did that because I chose the specialization because I had a lot of interest in economics. But later on I found out that health economics policy and law had a lot of economics, but also a broader view with the policy and law courses. So because I want to broaden my view a little bit more, I choose to switch after a few weeks from the specialization to the HEPL variant. And that's why I choose this master, because you learn so much about the broad view on health economics, policy and law, as well in a national as an international view.
Maurice, now that the floor is yours, another question. Is there a student association for HEPL? And if so, which activities do they organize?
As far as I know, there's students association for as well every how should we call it, the bachelors and the masters all in one. I think Maureen, the other ambassador, is the president of that students association, so I think she could elaborate a little bit more about it better.
Yeah, that's true. Thank you, Maurice. We have a student association called SHARE, and they organize study-related activities for bachelors, but also master students. So that goes from readings to drinks to trips and so on, and both study-related and non-study related.
Okay, thank you. Lucas, some students would like you to discuss a little bit more what the difference is between HCM and HEPL. And a question perhaps that will help. So if you want to be in management of hospitals in the future, healthcare management would be a better choice. And HEPL is more broader and international study, focusing more on the overlooking view of healthcare.
Yes, sometimes we jokingly say if you want to be a manager of a hospital, choose healthcare management, and if you want to be the Minister of Health in government, then you choose HEPL. But not everybody in healthcare management may agree. But it's really the most important point is that the difference of the level at which we look at problems in healthcare. Really, the organizations of hospitals and other institutions or policy and more abstract topics like the behavior of people when they have to pay more or less, they get paid more or less. I would also say that HEPL is a little bit more quantitatively focused than healthcare management in general. There are also numbers in healthcare management. There are also other things in HEPL. But the national and the international perspective compared to the organization perspective is the main difference.
Another question that I will answer for you: is there a pre-master for this program? The answer is yes. So
Yeah.
Might be just an easy question.
Yeah, if your background is not sufficient to be admitted directly, then the pre-master program is a one-year program, and that might be suitable for you.
Perhaps, Suzanne, you can share the Zoom link to the session on the pre-master in the chat so that people can go there if they want to learn more. Another question, Lucas, is: are there scholarships for non-EEA students, and also is there a fee payment plan?
We have a limited number. We have a few scholarships every year for people who apply from outside the European Union, who apply for healthcare management and HEPL. And there's also a fee payment program. That means that you can spread out your payments over a certain amount of time.
A question about the pre-master: is it also in English?
No, that's a good thing.
Good question. Yeah.
Important to mention, the pre-master program is only in Dutch.
Okay. Then I have a question, but perhaps Suzanne, you can help us with that. Because on the website, apparently the application date that is published is January the 1st. Well, that is a bit soon. So there are several application deadlines. So can you shed a little bit more light on that?
When can people apply, and when do they have to?
Yeah.
You can also say something. You should be able to apply now, and you can apply until the summer. But if you want to have, if you want to know whether you're admittable, then please apply as soon as possible.
Yeah, and I think what is also very important, applying does not mean that you are really subscribing to it. So you can always retrieve your application. It's only when we receive your payment that you become a student. So it's that simple.
Yeah, we will. When you apply, we will only tell you if we are willing to admit you, and that's all.
Yeah.
So, no strings attached.
Another question about scholarship: how do I get a list of scholarships available for HEPL in 2021 for non-EEA students?
I don't have the detailed information now, but it should be on the website. If it's not, it may not be on the website of Erasmus School of Health Economics and Health Policy and Management, but it will at least be on the international website of the Erasmus University Rotterdam.
Yeah, because it will also depend. Of course, we have certain scholarships, but also the country from which you're from also has scholarships to pay for your studies.
Yeah.
So there are two ways to going about that.
Yeah. I knew that these scholarships will be awarded somewhere in spring. I think it's in May or around that period.
If I have read the chat correctly and summarized the questions correctly, except for the new one who's coming in right now, does HEPL also look from an organizational perspective or a micro level at problems in organizations in the courses? Or is healthcare management a better option in this case? well, as the director of healthcare management, I think that this is actually exactly one of the main differences between HEPL and HCM. That healthcare management is really looking from an organizational and a managerial perspective, where HEPL is taking a more governmental policy level focus. So does it also look? No, not as much as, or hardly compared to healthcare management.
I agree.
Well, again, I think I have asked every question in the chat, but please, everybody who is still here, correct me if I'm wrong, and if you have additional questions for Lucas.
Or for our students.
Or for our students, most certainly.
You want to know anything about their student experience? They got what they thought they would get. Yes, Maurice, are you still here? Yeah, you are. What did you like most and least about the program in the first few months?
Well, to be honest, I've only followed one course yet, so I can't really make a conclusion about the master program.
Which course?
What I like the most yet, so well, I think it's a really I followed the Economics of Health and Healthcare course. Like Lucas already told about, and it's a really good combination of theory and working groups where you make exercises and think about yourself. It's not just theory coming one way, it's also start thinking about it yourself and doing exercises, collaborate with your teammates in a group project. So yes, I think until now that's what I like the most about it.
Are there any other questions that we should address?
Yeah, well, there is one who says, sorry for asking again, but you're not qualified for HEPL if you have a Bachelor in Business Administration. I think that's more an overarching question. If you only have, if you have any questions about if you're admittable, please apply. Because it will completely depend on what you did actually within this Bachelor in Business Administration, what type of courses you have chosen, electives, if you can be admitted or not. So we cannot answer these types of questions without seeing your whole curriculum that you followed.
Yeah, with regard to business administration, and as well to almost all other programs, we can't say yes or no. We can't rule out that you could be admissible, and I can also not guarantee it.
There are two more questions related to the difference between healthcare management and HEPL. One is about your job perspectives for the future. What are the main differences? And the second one is kind of related to that, but more specific. And that's the question: in order to work in regional national healthcare agencies, which master course is better, HEPL or healthcare management?
Yeah. National regional healthcare agency. Well, both could be very useful. It depends on what the agency does and what you would do within the agency. If it's more about organizational questions, healthcare management is more appropriate. And if it's more about choosing what kind of healthcare to offer, for instance, or how it should be paid for, that might be more a HEPL or health economics problem. What was the other question? Yeah, the type of jobs that people end up in. I think, well, jobs that have to do with management, that is where more healthcare management students end up with, and HEPL students tend to end up more in research-related jobs or governmental policy jobs. But that's not really black and white. There are also HEPL students who work in hospital management, and there are also healthcare management students who work at government departments, for instance.
I think what Lucas said with regard to the national and the healthcare agency, it's not so much that the type of job is so different, because in both you can become a manager, a consultant, or a policy advisor. It is the types of problems that you will focus on as being so. So if they are searching for somebody who can do policy analysis of the future state of affairs financially in the Netherlands, then if you're a HEPL student, you would be a better applicant than a healthcare management student. But if you should have a policy job in which you need to think about how we can reorganize institutional care into extramural care in the Netherlands in order to cut back costs, then healthcare management is more logical. So it's not so much the type of job, it's the content of the topics within your job that you will focus on.
Yeah. It's almost 1 o'clock, so I suppose that some of you have other places to go or other sessions to attend. So I would like to thank you for your attention. If you want to stay and talk to students, that's fine too. But the formal session has to end here. Thank you very much. And if you're interested, please apply. And I hope I will see many of you in September in real life in Rotterdam.
I think there's still personal questions for Maureen and Maurice. So as I am leaving you at the end of this formal session, perhaps Maurice and Maureen can answer this student-related question.
Yeah. Thank you, Isabel.
Yeah, Maurice and I both have the same background, so we both did the bachelor in health policy and management. And I chose for HEPL, yeah, a bit of the same reason as Maurice already told you, but because of the combination of economics and policy, and a little bit of law.
A little bit of blah?
Law.
Oh, law, sorry. There's not much blah in...
No.
No. Are there any other questions about the student experience? I see most people are leaving. We seem to have answered everything that they wanted to know. Okay, I think we can end it here.